All right, guys. Hey, it's Jamie here with Milk Allergy Mom, and I have the honor and privilege of hanging out today again with my board-certified allergist immunologist, Dr. Siri. Good morning, Dr. Siri.
Good morning. This is an awesome morning, and thank you for inviting me to join you. And I guess we're hanging out virtually, just like a lot of people are.
We are. Virtual is the way to go these days. Dr. Siri has been practicing medicine for several years. How long has it been, Dr. Siri? I know we have been visiting you for 14 years to manage our food allergies, environmental allergies. Are you counting years in your head right now? Can you hear me okay?
I heard, yeah, I can hear you now. There was just a little glitch right there.
Oh, I'm sorry. That I thought something happened. Your eyes were all closed and I thought, is she asleep? So how long have you been practicing here in Central Illinois or altogether?
Well, if I tell you that, you'll know how old I am, which is
Oh, well, I can say that you have been our amazing doctor for over 14 years.
I've been a physician for 20 years.
That is, hey man, we are in good hands. I love it. And you were a chair at our big clinic here in Central Illinois, and then you left to start your own practice. And I loved that because with that meant that you were able to start doing trials and start your trial clinic. You have been helping us treat milk allergy and environmental allergies for the past several years. You have been helping people desensitize food allergies since before OIT had a name. So you have a lot of experience and we love being in your care. Today, here's what happened, Dr. Siri. This is why we're on this topic. Today, I want to talk OAS. It is a topic that pops up in allergy mom groups on Facebook all the time. And sometimes moms are like, what is that? I've never heard of that. And the reason I thought about it was, one, it's like the season right now where we're hearing about it quite a bit. People are gardening, growing fresh food, and having these unusual symptoms that they want explained. And two, I was making our peach cobbler the other day, was cooking up peaches, and it just reminded me that this is something to share with families that might be dealing with OAS, because cooking those peaches has been part of kind of what we do to manage some OAS stuff. So I thought, let's bring Dr. Siri on to really talk about this officially. Can you tell us real quick what OAS is?
So the highlights of oral allergy syndrome, which is also known as food pollen syndrome, are simply that people who have pollen allergy, particularly the outdoor pollen, such as tree pollen, grass pollen, weed pollen, they can, in unusual cases, develop a cross-reactivity with the pollen to foods that have been uncooked. So those are things such as birch tree pollen allergic people now have issues eating foods such as apples and pitted fruits, plums, etc. They experience mouth itching, they experience discomfort, maybe even mouth or throat burning when they eat these foods. Typically, it is foods that are uncooked. So if the person is having problems with the cooked food as well, then they actually may have an allergy to all forms of that food. So oral allergy syndrome is a type of food allergy. It is a cross-reactivity between the outdoor pollen. And so usually, most people can eat those foods when they have been modified or cooked, and they have no problems with it. So the question is, if you or your child are experiencing issues with itching, mouth burning, feeling spicy tongue when, because like a lot of kids describe it that way, when they're eating a certain food, they may certainly have a severe pollen allergy. It usually occurs in patients where their pollen allergy is quite strong, quite brisk. It's probably about 10% of all the allergic rhinitis patients. So if you have oral allergy syndrome or food pollen syndrome, you know that you're in that top 10% of very allergic people to that pollen. So one of the questions people ask, well, how do you test to it? The blood test is not going to be positive in those cases because the IgE to foods is really not to peach protein or to apple protein. It is actually a cross-reactivity to the pollen of the trees or the grasses, the weeds. So the IgE to trees, grass, and pollen and weeds, weed pollen, that actually will be positive. So typically those individuals have a very strong skin test or blood test to the outdoor pollen, with some exceptions aside, such as young children or people who don't make a lot of IgE that free floats in their blood, because most of the IgE is in our tissue. So that's usually positive. And the other thing that becomes positive as well is reactions to the uncooked fresh fruit, so or vegetables. So in our clinic, we do something called prick testing. Patients will bring in a variety of uncooked fruits and vegetables, such as raw carrots or raw apple, and then we'll do a prick to the live food, the biological food, and then we'll actually prick their skin, and that will actually invoke a reaction. So then you know, and I've seen this many times, from bananas to apples to watermelons, you name it. People, the extract is negative, that's coming from our tray, the blood test is negative, we know they have a ragweed allergy or a birch tree allergy or a grass allergy, and then it lights up like a Christmas tree when we prick it on their skin. And so then that is the diagnosis of oral allergy syndrome. Most people actually don't need testing. You can kind of think about the food groups that are published online. You can think about the fact that you may have a severe tree pollen allergy or grass pollen allergy. And then usually we put 2 and 2 together. But many people don't realize that this is a form of a food allergy. So then how do you get rid of it? How do you treat it? Well, unfortunately for you, if this is developed, your food pollen issue will not go away unless your pollen issue is treated. So many of our patients who are on either sublingual immunotherapy or allergy shots to that pollen, once they've desensitized to that pollen enough, then usually they can reintroduce some of those foods over time. But again, we're still very cautious. So is this a dangerous form? Because many people ask that. Well, obviously, if you're eating something and your mouth is spicy, it's burning, it's itching, it's kind of a sign that your body says, don't eat anymore. Have we had patients ignore the symptoms or take antihistamines because they really like those foods and they want to eat them? Sure, we have. But then you get into the dangerous kind of potential area where now you're eating a large quantity. There's a lot of chemical histamine release as well as some other chemicals that are being released. And now you're ingesting it and it's going lower down. So some people then can have GI anaphylaxis, and they can even potentially have full-blown anaphylaxis. So really, you should pay attention to your symptoms. If you're having those foods that are causing those symptoms, you probably should go ahead and stop eating them. And then we can talk about strategies. These are very healthy foods. We want people to eat them. So we can strategize as to ways you can modify the foods, cooking or freezing the foods before you eat them, those kind of things, and certainly talking about immunotherapy to the pollen that may help the oral allergy syndrome.
Right. So it's one thing if they already know they have environmental allergies and they're treating those, and they can go back and talk to their doctor and say, I'm having these oral symptoms. It's another thing if they've never even been treated for the environmental allergies, they're having those symptoms. And I mean, for myself, I just know pineapple and kiwi are just like, my tongue gets all, and I can't do anything to get rid of that feeling. And so if they have not talked to an allergist yet, and they just know that certain fresh foods give these sensations, that is something probably they should start exploring with an allergist if they want to just dive deeper, find the root cause, and possibly be able to do some things that can help with that reaction that they're having.
Yes, 100 million %. Because if people don't know what the real problem is, then they really should find out, because it would be a shame to avoid all these healthy, delicious foods if you don't really have to.
Exactly. And one reason I wanted to do this video is so many people go through life with that sensation, or go through life with that sensation and don't know that there is something to that. Or as a food allergy mom, this is what happened to us. We knew that our son had anaphylaxis, had a milk allergy, and then started eating these fresh foods and describing a sensation similar to what we were always paying attention to for a severe food allergy reaction, and didn't know what was going on. Like a big panic. Oh my gosh, he's reacting to carrots, he's reacting to cherries, he's reacting to peaches. And we really had to learn from you that there was something to this, but it was a little bit different than what we were experiencing, than what we had our history of having a milk and nut allergy and all those things. So it's definitely something to explore with an allergist. If you or your kiddo is having those sensations, know that those do happen. We're not just talking about picky eaters who don't want to eat or, you know, are making up stories about their tongues or their mouths. And of course, this is all just for educational purposes, no medical advice coming from us, but we want people to be able to take this information, go talk to their allergist, make good use of their face-to-face time, which is sometimes very minimal with a doctor, and be able to ask good questions and get on a really good track for their allergy management as quickly as possible so they can make some good fun changes in their food allergy journey. So we really appreciate you coming on today and answering what OAS or oral allergy syndrome, and then you also gave another word for it, which I often hear, which is what? Pollen syndrome?
Food pollen syndrome.
Food pollen syndrome. So all of those are interchangeable, and you'll now know what that is when you hear it mentioned in all the allergy groups. Moms do talk about this, especially during this time where we're hitting the farmer's market, we're growing vegetables in our gardens, and we don't know what is going on. I know with us, we had a little bit of that with some fresh sweet peas last year, some peppers. So it just kind of pops up here and there, and I'm so thankful we have you to help us manage this journey, because it is about opening up the possibility to be able to eat those healthy foods, and doctors can really possibly get you there. Good allergists like Dr. Siri, and we're so appreciative that my kiddo's able to eat extra foods now, and I probably should work on it for myself. So Dr. Siri, where can people find you if they want to learn more about your practice, your clinics, and what you guys are doing here in Central Illinois?
Well, our website is asthma2.com. It's ASTHMA, the number 2.com. We also have another website, which is an evolution right now. A lot of it's just thoughts I put on paper, but it's treatfoodallergy.com. And so I'm working on that, and then I'll have more information about, you know, the modern approach to food allergies, which is to treat it, to see if we can desensitize kids rather than avoiding for the rest of your life. So as you know, we've been doing that for a long time. And certainly we are the food allergy experts in Central Illinois. We have a lot of protocols. Our nurse practitioners, we have a champion food allergy champion in each office. And so certainly if any of your readers want to come check us out, we also do a lot of online consults for people in other states and things like that.
I love it. Dr. Siri, I have to tell you, just this week, I had 3 allergy moms, mostly our members, contact me and say either they've graduated from food desensitizing. 2 of them have graduated, and 1 was moving on to the next step, and they did not know about desensitizing food allergies until we started doing these videos together and spreading the word. So that is why you and I do this on a Saturday. We want to help as many allergy families as possible find hope and freedom and fun in their food allergy journey, and it is always an honor to work with you to help families find a new path that can bring them what the kind of things that they're looking for, just more freedom in their life. So thank you so much for being here, and I can't wait until we find our next topic to talk about.
Thanks a lot, Jamie, and thanks to you and your team.